All right, hi again, everybody. It is time again for another 8 minutes or so with Dr. Janet Memark. She is the head of Cobb and Douglas Public Health in this county, and she's been trying to talk us through this whole COVID-19 thing for the past several weeks and actually several months now. And one of her big worries is, it's no secret to anybody who's been out and about, that a lot of people are trying to transition their lives back to normal. In fact, downtown Marietta behind me here is obviously much more active. People are eating out on the sidewalks now and even in some restaurants here and trying to move things back to normal. But Dr. Memark's theme, at least for today, is that we're not quite there yet.
Things are coming along here in Cobb County. So as you know, the governor's executive orders have went ahead and released some of the businesses to go ahead and reopen, and we've been working really hard with different businesses to help them to reopen safely. At this point, though, we know we have over 2,400 cases of COVID-19 in Cobb County and 133 deaths. So, you know, we continue to have new cases that emerge, and now we're dealing with new outbreaks and clusters in different areas as well. And so this is a really good time. I wanted to talk to people after the shelter in place was lifted, except if you're medically fragile and over the age of 65. But I wanted to really talk with people about this because I know a lot of you have been out and see that it does appear that we have really reopened, and so there's a lot of people out, and I know that we want to go back to the way it normally was, and I just wanted to make sure that everybody understood that it is not like it was. And so we can move forward and open and get some of our lives back, but we have to remember that COVID-19 is still there, and it's still a problem, and has not gone away in our community. And so when I went out, I did notice there was a lot of people that didn't seem to want to wear masks, and you know, that puts a lot of people at jeopardy. And so if we can just try our best to wear some sort of mask and wash our hands and use that hand sanitizer as often as we can, it's going to help to decrease that risk for us. We were just talking about how we're watching the hospital systems, and there's a fluctuation in the number of beds and ventilators that are being taken. And so the best thing that we can possibly do to slow things down is to try to wear our masks and stay home when you are sick, and to be able to socially distance the best that we can, and make sure we wash COVID-19 off of our hands by washing them as frequently as we can.
So another big thing that a lot of people talk about all the time is when you're out and about, how to protect yourselves, and should you be protecting yourselves? Should you be wearing a mask? I had a meeting inside the Cobb County Government Building earlier today, so I was with a group of people wearing this bad boy pretty much all day. Not the most pleasant thing in the world, but everybody else was wearing it, so we were all one big happy family. But a lot of people don't want to wear this. But Dr. Memark says this is not all about you.
There's two prongs to this. It does afford you a little bit of protection, but you know, this is a very, very difficult battle we're fighting here. It's not only just what we can see and what we can hear and feel with symptoms, it's the asymptomatic spread. We are getting a lot of people that are reporting no symptoms that are coming back positive with COVID-19. And everybody needs to understand that it's not just some research that's out there, that definitely it is being seen, and so you don't know you have it. And then we see people, it's not uncommon that they will pop symptoms a few days later. And so the only way that you can do this is you make sure you stay at home when you're sick, but knowing that you could get it and spread it for a few days before, wear those masks when you go out in public and around other people.
All right, so about testing. Testing is now available to everybody. You can make an appointment without having any symptoms, without getting a doctor's note or permission or anything like that. Testing is key, so Dr. Memark says, if there's any doubt, any worry in your mind, take advantage of it.
So testing has been opened up, and so it should be fairly easy for people to get a test if they need it. And so we have different locations here, and the hospital systems and our retail facilities have different testing capabilities. So you should be able to get a test. Now, there are some areas that can't get tests that we are working with. So, for example, our people in homeless shelters and people that don't have access to vehicles. We're working to do some outreach with our partners, with Wellstar and Metro Ambulance and our local community leaders, to try to get out and get testing available to them as well. So we're going to try our best to bring it to them so that we make sure that we really cover some of our most vulnerable populations.
So one thing that does bring a little bit of a smile to Dr. Memark's face is the fact that even though some businesses are now allowed to open and resume normal operations. Many of them are taking it very slowly and very cautiously. She says she's happy to see that a lot of people want to do it safely.
You know, I see a lot of shifts in the business community and trying to reopen safely. It really warms my heart that they're taking it seriously and want to reopen as safely as they can. And so we get a lot of questions from them, as well as the school systems. They're trying to plan ahead, but it's so hard when we don't know exactly what's going to happen. So that's been difficult, but they've been very proactive, trying to stay ahead of it. And I also get questions from the community as well, just being concerned, and I get that. I understand that about having to go back to work and having a lot of contact, and but there's a lot of guidelines that are in place, and just trying your very best to make sure that you protect yourselves by washing your hands and wearing face masks as often as you can. I think that will go a long way.
All right, so let's be honest. Aren't we all sick and tired of this? I mean, we've had enough of this. We're used to just going out and doing whatever we want to. Can't quite do that right now, but that frustration does run deep.
I am feeling that too, and so that's a really hard one to answer, because I know we're all tired of being cooped up, and even my own children are just dying to get out, and I try to. I know it's really hard. Like, my kids are tired of each other, and they want to go and be with other people, and so I try to do it as safely as I can, and so trying to do outdoor activities and trying to social distance. My kids and my family all have masks if we have to go out, but I think they have the advantage of me coming home and bringing more information to them and knowing how serious it is. But I just don't want to come back and have to ring alarms for everybody. If we try our best to socially distance and do the best we can, we will slow it down significantly. I just don't want everybody to just throw caution out the window at this point. So just try to remember that it's still there. I know all of this coverage doesn't really help, but it is definitely still there. We are definitely still finding cases, and it's still a battle we're fighting.
All right, so as Dr. Memark says, we don't want to move backwards when it comes to COVID-19, so take those precautions. Don't go out unnecessarily. Wear masks, wash your hands, do everything appropriate to avoid coming into contact with the dreaded COVID-19. Please go to cobbcounty.org. Our COVID-19 page is still being continuously updated with the latest. The county here, we're beginning to plan to reopen buildings. We've reopened parks. We're going to start to reopen libraries and more facilities as the weeks ahead progress. So log on to cobbcounty.org and check out all our plans if you're interested in what's happening in this county.